Hey, how you doing? Thank you.
Ladies and gentlemen, please welcome the next President of the United States, John Edwards!
There are very serious problems in our healthcare system. I'm actually very proud of the fact that I was the first, am the first as of now, presidential candidate to lay out a detailed, substantive, truly universal health care plan, which I think America desperately needs. I'm going to talk about it. This is the way this health care plan works. Employers, let me go through each of the responsibilities. The employers are required to cover their employees or to pay into a fund so that there's coverage. The government plays a very important role. The government will set up health care markets around the country. In each of these health care markets, a number of things will be accomplished. First, there'll be choices from which people can choose the health care plan that they want. Some of the choices are private insurers. One of the choices will be the government. It'll be something similar to Medicare or Medicare Plus. But basically, there are going to be choices available. There will be efficiencies created that don't exist in our healthcare system today. We're going to dramatically lower administrative costs. About 30 to 40% of every healthcare dollar goes not to healthcare, but to administrative costs. We're going to use technology in a way that, and then mandate it in a way that's not being used today. We're going to have electronic medical record keeping, job lock. What we do about job lock is if you have your health coverage in one of these health markets, then you can go either leave your job or go to a different job and keep the health care that you've got. So you don't have to worry about moving from job to job to job. You will continue to have the health care coverage that you choose. Lower income families will be completely subsidized. Middle income families will have help, and as you go up the income ladder, it goes up to somewhere between $80,000 and $100,000, at which point the subsidy stops. This is not just about helping the poor. This is also about helping the middle class in this country, the vast majority of Americans who are terrified about their health care coverage. And I'd be willing to bet there's not a single person here today who doesn't have your own personal story about health care. But, you know, I have my own. When Elizabeth got breast cancer, you know, right after the election, sitting and watching your wife get chemotherapy is not a pleasant thing to go through to begin with. But I kept thinking about it when we were sitting in those hospital rooms, what it would be like if you had no health care coverage. What would it be like for the millions of women who've been through what Elizabeth's been through? What if you were one of the women who've gone through breast cancer and breast cancer treatment, chemotherapy, losing your hair, the debilitation, all the extraordinary impact that it has on you, what it does to your life and your family, and you had no health care coverage? And all I could think to myself is, the United States of America is better than this. We can do better than this. We need to make sure that at the least, when families are going through that kind of difficulty and that kind of stress, they shouldn't be having to worry every single minute about how they're going to pay for their health care coverage. Thank y'all for coming. Thank you. Thank you. Thank you. Thank you. Thank you.